Do we get breaks around here?
No, there's no breaks, dude.
Oh, God.
This is showbiz, baby.
I wasn't made for showbiz. Okay. Anyway, some of us are a little... Okay, so... Hi, everyone. Welcome back. My name is Brandon Dunn, and this is Tripathi.
You're introducing me now. Do you know how to pronounce my last name?
Tripathi?
Yeah.
Anyway, and we are the Face Duo. And today we're going to talk to you about the essentials, the must-haves for scrapes, bruises, and cuts at home.
Yes. Okay, so you fell and you got a scrape on your face.
Oh, no.
Not a cut, not a deep cut, not like a laceration, but you're scraped, there's some skin off, it's bleeding. What do? Like, do you need to go to the emergency room? Do you need to, like, what are some steps that you can take?
So the biggest thing is to prevent infection.
Yeah.
So number one is to clean. Clean, making sure that you're using soap and water to clean. You don't need any other things. You don't need
Hydrogen peroxide?
I love hydrogen peroxide. No,
you don't need it.
Not hydrogen peroxide. You don't need hydrogen peroxide. Hydrogen peroxide actually introduces more trauma. I think there is a role for hydrogen peroxide for certain types of cuts, scrapes, and bruises, and we can kind of get into that. But in the early stages, number one is to just go to the sink, go to the bathroom, and wash and clean the area with soap and water.
And we say in plastic surgery or in wound healing, the solution to pollution is dilution. So the more that you can flood the area with fluid, that will dilute out all the bacteria. But you also want to get out like dirt and little like rocks and gravel and that kind of things, because those can actually leave traumatic tattoos in the skin.
Exactly.
So get all that stuff out, get it super, super clean. Okay, next. So the second thing is hydration. So wounds and scrapes and cuts heal best when there's a way for the cells to go across that area fast enough, and it can't do so in a dry environment. It used to be the thought that if you just left things open to air and dry, that you would heal faster, but in reality, lots of studies have shown that when an environment is moist,
a moist wound is a healthy wound.
Such a disgusting word.
Yeah.
That it heals better.
It's necessary.
So, right. And I don't recommend using anything like Neosporin, polysporin, because those have a very high rate of allergic reactions, especially in the United States. So using something like Aquaphor or Vaseline is generally fine. You just want to make it have an emollient or an occlusive area where water's trapped in the skin and that it's maintaining moisture. So you don't need antibiotic ointment, just keep that area moist.
And the reason why you keep it moist is so that you decrease inflammation.
Yes.
And you decrease more inflammatory cells. There's already a big process that's going on underneath to be able to kind of heal the area. And if there's more, if it's dry and if it's scabby and if it's bleed, it can harbor bacteria and it can create more inflammation, which can also result in pore scarring.
Yes.
So that's the big thing. How long do you have them do that? How long do you recommend individuals to use this?
I have them do that until their skin is fully covered over.
Exactly.
So when the skin has created a layer over it, you don't need to continue very aggressive. I mean, you can continue to moisturize as much as you want, but then the third step comes in, which is sun protection.
Sun protection and?
Scar, like silicone gel?
Yeah.
I mean, you could. Like, I think for scrapes and stuff, you probably don't need silicone, but you can.
Yep.
But you really, really have to be diligent with sun protection, because especially if you're dark skinned like me, any cut, scrape, or anything is going to pigment, and it just gives, you know, much more chance of that dark pigment from happening if you don't wear sunscreen. So protect your skin from the sun. Put a big glob of sunscreen when you have a scrape, especially on your face, sun exposed areas. Let's move on now. What about a cut, like a laceration? So you've got like a laceration on your nose, your eyelid, your lip, like,
so this is more serious, and I would say this is something that does require evaluation by a professional.
Why?
So, you know, and the reason is because, yes, I would say in certain areas.
I just winked at the camera, but I'm really bad at winking.
Yeah, can you not make us uncomfortable?
Sorry, go ahead.
So in certain areas, it may be okay if it's an extremely superficial laceration to be able to let it heal on its own. Your back, your stomach, the back of your arm, something that you maybe don't necessarily have as big of a concern when it comes to a cosmetic outcome. But definitely on your face, I think that you should have an evaluation by a professional. And the reason is because the depth of the incision or the depth of that laceration does need to be assessed. If it's deeper and it goes through the dermis or even halfway through the dermis, you can get basically splaying of that incision, and ultimately that would result in widening of the incision. And so then you're gonna get, you're higher risk for getting hypertrophic scarring or potentially keloids if you have a genetic predisposition to that. I guess what's the window of time that you would say people need to get their cuts and lacerations assessed?
I really think if you have a cut on your face that you should, in the next 4 to 8 hours, go to an emergency room or your primary care doctor if they can refer you to get it cleaned out thoroughly, because you may not be able to do as well of a cleaning. We use higher pressure to clean those areas. But usually, ideally in the first 4 to 8 hours, because if dirt and stuff gets trapped in there, if you start to develop scar tissue already, which is very fast on the face, because the face wants to really pull that area together, then things can heal poorly. And in addition to just like scarring and hypertrophic stuff, it can be uneven. When things are uneven on the face, it is very, very noticeable. You have very few places on your face where there are sharp lines. Your lip line is one of them, your eye is one of them. And when things are off by even just a fraction of a millimeter, it can be very noticeable to the naked eye. If you imagine seeing somebody with a lip that's just a little bit off, it's very, very noticeable. So I recommend that people go quickly to the emergency room. I mean, if you have obviously bigger things going on, it can wait, but the faster the better, because it can get cleaned and sutured up fast.
Yeah, exactly. And not every laceration necessarily needs sutures, but some of them, you know, if they do go deeper, they'll need multiple layers of sutures, and so having a professional evaluate. Okay.
Absolutely. And then the same things, moisture, sunscreen. Down the line, you might need scar revisions like lasers, but the same things apply as scrapes. You want to keep it moisturized, you want to use sunscreen, you want to use a silicone gel afterwards to just make sure things heal really, really well.
I will say one thing that I'd like to add to this is I do like a little bit of hydrogen peroxide on a Q-tip to be able to kind of clean an incision. Occasionally in the early stages when not everything is fully healed up, you will get a little bit of weeping of normal fluid or even some blood products that kind of crust up and dry up, and that helps to really clean those stitches and make sure everything is nice and clean. So I think a gentle amount of hydrogen peroxide on a Q-tip rolled along the incision is something that's nice, keeps your incisions nice and clean, and then applying moisturizer on top of that afterwards. And so, you know, not everyone's gonna agree with that, but that's kind of my go-to.
I don't do that for traumatic lacerations. I feel like the skin edges are already kind of beat up. But for surgical incisions that are cut very precisely with a scalpel, and those bleed quite a bit throughout the healing process and they crust, those are ones I definitely use hydrogen peroxide for.
Okay.
But again, the same things, no Neosporin, polysporin. There's just
Definitely
really
not.
no reason to use antibiotic ointment on a wound or an incision or anything like that.
Unless you have signs of infection, then you should have, yeah, exactly. Take oral antibiotics or use a different type of topical antibiotic.
Yeah.
Okay, very good.
Is that it?
I can't think of anything else. But this has been a long day.
Okay. So, in summary, if you have a cut, a scrape, or a laceration on your face, the main thing to do is get it cleaned out really, really well. If you feel like it's deeper than it needs to be or that you're not comfortable with it, go in to see your plastic surgeon or into the emergency room where they can refer you to a plastic surgeon so you can get sutured properly. Maintain it at home with good skincare like moisture, Aquaphor Vaseline, silicone gels, and sunscreen to prevent it from getting darker and to protect it from the sun because it's fragile skin in the healing phase. If you like more of this content, like, subscribe, and follow for more for the Face Duo, and we'll see you next time.